Thanks everyone for joining today. My name is Deb Kazmerzak, and I am provide staff support to the Iowa Association of Rural Health Clinics. Happy to see you with us today. We have a couple of other staff on the call. Virginia, whose picture you see with SPPG up in the corner, and another behind the scenes who is recording and trying to capture names and that kind of thing. The purpose of this webinar today is really just to bring an opportunity to the rural health clinics that is being offered through Amerigroup Iowa. So this is kind of an informational webinar. I think John has a brief presentation to share with you and can talk to you about how you can follow up if this is of interest to your RHC. And then we'll have plenty of time for question and answer. We scheduled 45 minutes, but we may not need that much time. So I am just real happy to introduce John McCauley to you. John is the Health Equity Director at Amerigroup Iowa. I've worked with John on kind of a number of things over the years. John has a deep history in Iowa's healthcare system, working in long-term care, people with disabilities and aging populations before he joined Amerigroup, and probably other things that I don't know about. But he's been with Amerigroup, I think, for probably since Amerigroup started up or shortly thereafter here in Iowa. And so really happy to just offer this opportunity for John to get in front of the RHCs and talk about what they're offering. So with that, John, I'll just turn it over to you.
Thanks, Deb. I appreciate that introduction, and that was a pretty good Cliff Notes version of my history. You'll notice that I'll be flashing this in front of you. I'm a UNI grad. I grew up in Cedar Falls, and I'm broadcasting to you live from my West Des Moines basement office today. We are working in a hybrid mode at Amerigroup still, where our offices are just a touch point for in-person meetings, and most of our work is done in a work at home basis. Just a quick note about Amerigroup Iowa. We are the only managed care organization that has lived the full life of our contract cycle from 2016 until today. And we are, the administrator of the Medicaid program in all benefit forms. That includes long-term services and supports, behavioral health, physical health, the Hawkeye program, and TANF. And we, as a portion of the Medicaid program, have 58% of the Medicaid membership in the state. So, and we've been here long enough to have learned an awful lot about the health care of our members, and we have moved from simply administering Medicaid benefits and processing claims and prior authorizations and utilization management to moving into a whole health sort of posture, looking at social determinants of health, all of the factors that impact our members' health care outside of the traditional Medicaid benefit, and have moved into identifying statistically significant health disparities in populations that have historic socioeconomic access or barriers to care, whether that's rural versus urban, persons of color versus the white population, various different disease, chronic conditions, including behavioral health and substance use disorder, as well as maternal child health focuses. And that has allowed us to pivot into looking at whole health rather than just the Medicaid benefit itself. And it's led us to experiment with some innovation. And I'm bringing to you one such innovation as an offer at no cost to your rural health clinic. And it's built on the experience that our entire country experienced with the onset of the pandemic, and that is the rise of the utilization of telehealth services both for physical health as well as behavioral health. We saw a lot of increases in claims for telehealth in Medicaid, and we decided that we would try an innovation building off of that experience to try to increase access to care for individuals who may not have as good access to care as some Medicaid members. And it's this concept called a telehealth kiosk. I'm going to start displaying my screen right now, and we can distribute this brochure at the conclusion of the meeting. I think it might have circulated prior to the meeting as well. So moving to share now. So our Digital Solutions Kiosk program is a program where we are offering literally an iPad on a stand that is loaded with applications that help the user gain access to health and behavioral health services. What's loaded on the telehealth kiosk is LiveHealth On-line, which is the very same telehealth program or benefit that our members can access through our website or through our app. Also LanguageLine, which has up to 40 languages in audio visual translation and 140 language in just audio translation. Brightheart Health, which is our behavioral health telehealth platform. And then Aunt Bertha, which is also now called Find Help, which is a search engine that is accessible to anybody that's interested in finding providers or community-based organizations that supply assistance with anything from transportation to housing and rent assistance, food security, and the whole host of social safety net programs that organizations like community action agencies provide. And then finally, myAmerigroup.com, which is accessible for members or people who are using the telehealth who happen to be members of Amerigroup. The telehealth kiosk is usable by anybody, not just Amerigroup members. And we have been working to supply the telehealth kiosk with a variety of different kinds of organizations. And to give you an example, and we've supplied over 60 telehealth kiosks across the state with community-based organizations like immigration centers or warming shelters or homeless shelters. And one federally qualified health clinic, the Siouxland Community Health Center, is taking 5 of them. And then one rural health clinic that I'm aware of that is affiliated with the Montgomery County Memorial Hospital, and they may be taking a second for their Mills County clinic based on a conversation that I had with them this morning. And then community action agencies that often have satellite clinics that provide services like WIC and sometimes need translation assistance when they're not always, when their on-staff translator is not always available. So that is the basic concept behind the telehealth kiosk. I'm going to switch screens and bear with me for a sec. I want to show you actually what it looks like. Okay, I'm back to that. All right. So there's a telehealth kiosk photograph. It's the iPad on the top with the adjustable stand, and it's on rollers. It can be used in clinical settings, in exam rooms, where, you know, perhaps a physician in a lightly trafficked clinic can come in and support a heavily trafficked clinic, or access to specialty care is a little bit more difficult in your area, and you need to get a specialist to do a consultation with a patient. Those are just a couple of examples at the clinical level. In the shelters, the shelter service providers that I've talked to have set this up in a private room where the people who are in the shelter can check out that room for a period of time and utilize this for whatever purpose they choose. And mostly it's access to care for individuals that don't have transportation to clinics, or don't, regularly see a physician, and are, only in a transient setting. And the clinic, the shelters are looking for ways to provide access to care for people who really, really need it, and really have taken this on and offered it to the people who reside or come and stay at their shelters. So that is the basic idea behind the telehealth kiosk. I'm going to pull that down. Amerigroup is offering this free of charge, and what we need to do is execute a letter of agreement indicating that we've supplied this and that you're hosting it, and some of the responsibilities that go along with it, like making sure it's charged, and that it has access to secure Wi-Fi, some of those basic things that I'm sure you're probably already doing with laptops for your clinics. So with that, I'm going to pause with the formal opening presentation and see if folks have questions. What's on your mind? How are you reacting to this? It's innovative. It's new. We are we think that this is a unique way of building access to care, but like you, we're kind of taking a leap of faith, and that's what we're asking you to do with this as well, is try it out and see if it does actually provide something of useful service for the people that you serve. So I'll pause there, take any questions you have.
I'll just start with one while others you can type in the chat if you want, or you can unmute yourself and show your video and ask your question of John. But John, when you and I visited about this in preparation for this, I think I remember you saying that even though it comes preloaded with these programs and these services, you can use it for, other things as well. It's got internet access. You can use it for telemental health or, other, it's just that it comes loaded with those resources that can be accessed. Is that accurate?
Yeah, that's right. We'll preload these apps, and, it will come with Zoom or Teams as well if you wanted to use those platforms for just about anything else. The language capability, the translation capability, is a subscription service offered by LanguageLine that the host would have if they chose language interpretation. They'd have to negotiate the subscription separately aside from Amerigroup, but that LanguageLine offers the service at a discount because we've negotiated a discount for the services.
Oh, nice. And there is a question in the chat from Jody, and I'm guessing we've kind of talked around it, but I'll ask it anyway, John. Would the clinic be required to access all of the programs? No,
the programs would be loaded, but you don't have to access it. It's what the member needs, really. It's whatever the member is driven to use the telehealth iPad for. So it's just that they're offered, and you don't have to access them.
What other questions do people have? I guess I'm not super familiar with what telehealth access the RHCs already have, and I'm sure there's a range. Some probably have systems in place, especially during COVID, and others may not. But I mean, from my non-RHC perspective, it seems to me like, every once in a while a patient comes in and you don't have anyone that can communicate with them with their language. And so the language line kind of access seems like a great thing, and might work a little easier than doing that via phone, which might be what you have to do now. And then I'm really interested in the prospect of using it in a telemental health. I know mental health is a huge issue for the RHCs. Rural areas, there is very little access. So this is a way of stretching that access. And then I would see, maybe one of your specialists at the hospital, that you need a consultation with. Either your clinicians need a consultation with, or a patient, it could be used staff to staff as well. So. Questions from anyone else?
I think that while we're waiting, I'll drop my email into the chat in case somebody wants to follow up with me directly. I may also get a community relations representative involved with the conversation if folks want to follow up, because I know they have access to the onboarding and training once a telehealth kiosk is deployed and shipped to a host. And then there's a short tutorial that comes along with it after the configuration is completed.
John, do you know anything about how any other of the medical clinics are utilizing it? The Montgomery County or the FQHC you mentioned? Like, is it in their lobby and their waiting room? So, patients can fill out their paperwork, or?
Yeah, it's not necessarily designed to help fill out the paperwork, although I suppose you could configure it to do that since you're accessing the Wi-Fi locally. This is really, really new. And so we don't have a lot of feedback on exactly how it's being used at the community health clinic of Siouxland. I know that they're using it in exam rooms, and it's the translation piece of it is what was really attractive to them at the time. They had an interpreter on staff that had left for another position at another organization, so it was fulfilling an unmet need. And at the community health clinic that's affiliated with Montgomery County, they literally just completed the training last week. So it's very, very fresh for them.
Okay. Just thought that might stimulate ideas. Seems like a pretty low risk offer. So the process, if someone is interested, would be just to send you an email, John?
Yeah, send me an email, then we'll set up a sort of a one-on-one conversation, just review what the program is and get a sense of the level of interest. And if there's some interest in moving forward, then I or a community relations rep will step through the very short letter of agreement, so that there's some understanding of that. And then if the interest is to do the language line, we would do a warm handoff to the language line representative that could work with you on terms of that side subscription. It's a separate contract, and that just sort of depends on what you need. I think they can tailor it to your unique needs.
Okay, give it another minute to see if there's any questions. You gave a great overview, I guess.
Yeah, it's this is an experimental program, and spend some time thinking about it and take a look at the brochure and digest it a little bit, and it may some ideas may occur to you after thinking about it a little while. It's some organizations see it as just sort of intuitive, as perfect for their the folks that come through. Others, think about it for a little while and think of a very unique niche application that's unique to them, and yet others decide that the services that are offered on the Amerigroup Telehealth Kiosk are redundant to services that are already offered by the clinic, and decide that it's not the right fit. So that's part of our learning and trying something new, right? And at the end of a year, we're going to know more than what we know now. Right now, we're just asking for folks to be curious, and if there is some interest, by all means, follow up with me.
Is there any deadline, John? Or is this like when you run out, you're out, or?
So supplies are limited, and how quickly the remaining 45 or so kiosks go is difficult to predict. We've had periods of time where there was, several weeks went by with no new orders, and then, all of a sudden we'd get 5 in a row. So I would say our supplies are strong enough to last us through the summer at least, unless, we've got 12 organizations, I think, on this call. If all 12 of them requested more than one, we would move through the rest of our supply pretty quickly, and we would be just fine with that.
Mm-hmm. Okay.
All right.
Well, I see a thank you for this comment in the chat, but I don't see any more questions. So,
well, I'll say thank you, Deb and team, for offering opportunity to present this opportunity to the rural health clinics, and look forward to hearing back from those of you who are interested, and just hope you have a great Independence holiday, and get some R&R whenever you can.
Sounds great. Thanks for being with us today, and thanks to the RHCs that joined. Appreciate it. Let us know if you have any questions. Thanks. Bye, John.